Hi there, my name is Carola and I am a biomedical science graduate and I'm currently studying medicine at Barts in the London. So I'm not properly working yet, but of course my aim one day is to become a doctor. Tell us a bit more about the role in the company. So of course the role of the doctor is very varied. The main role is to look after patients, help them, sort them out, but also a good doctor is involved into teaching, training anyone who's more junior than them, as well as getting involved in research projects. I'm currently at Barts, which is based in Whitechapel in East London, which is of course a very unique area for the medical student to be in. There is a very prominent immigrant population, mostly from Southeast Asia, as well as from anywhere in the world, really. So we're exposed to a large variety of diseases, including some that we don't really see commonly in the Western world, like TB. What attracted you to the role in industry? So I've always been thinking about medicine since I was a little kid. I've always been passionate about working with people, helping people, and just getting involved into their care. Um, After high school, I wasn't actually sure anymore. I wanted to do medicine. I'm originally from Italy, and there we don't have a culture of doing work experience before university. So um, I wasn't 100% sure what the job entailed, but at the same time, I knew that I wanted to do something that was related to human biology, which is why I moved to London and studied biomedical science. But then throughout my degree, I had the chance to do some work experiences, some more clinical work, and I realized that that was really what I wanted to do. The thing that attracted me the most to the role of a doctor was is the thought process, the thinking process behind starting from signs and symptoms that a patient presents with, and then through the history, examination, and investigation, really thinking of possible differential diagnosis as well as coming up with management plans. What attracted me to parts in particular are mainly two reasons. The first one is the area that I've already talked about, and the second is the community environment that we have at Bars. We do quite like to consider ourselves as a bit of a family. There is a lot of support amongst students as well as with the staff. We all have mentors that we can always go to whenever we have any worries, concerns, both related to medicine as well as personal problems. What pathways are there to get into the role? So of course I want to become a doctor, and the one pathway to get there is to go through medical school. There are different courses that you can do. There is the classic 5-6 year course that school leavers get into. You can also apply as a graduate, so some of the universities offer shorter courses for graduate students, or you can apply for a medicine course with a foundation year. So just doing a bit of general sciences before actually starting your med school. Um, and of course, you can do intercalated degrees throughout your medical career as well, which gives you a bit of an extra knowledge into a specific topic that you might be passionate about. But really, the only way to become a doctor is to go through med school. What key qualities are employers looking for? So, this is a really good question, especially if you're thinking about studying medicine and you're writing your personal statement, or if you have already applied for it and you're preparing for interviews. So there are two main qualities. There is a really long list of qualities and skills that employers look for in a good doctor, but I would say the main two qualities are empathy and resilience. So being able to build a relationship of trust, mutual respect, but also a personal relationship with the patient, because at the end of the day, everything we do is for the patient, and healthcare is very much patient-centered. But at the same time, resilience is essential. Medical school is very long. Medicine as a career is also very long as well. There are going to be many challenges, many stressful situations, and really being able to be resilient and to remind yourself of the reasons why you got into medicine in the first place is what is going to help you through all the difficulties and the challenges. And in terms of the skills, we look at general skills like good communication skills, which is both verbal, direct verbal communication, speaking to people, non-verbal, as well as so your body language, as well as being able to listen. Teamwork skills, being a good team player and team leader, and then just general organization skills and time management skills. Describe a typical week at work. So I'm currently in my third year of school, which means I've just started my clinical years. So my teaching is mostly an integration of clinical placements, where we learn the more practical things of the job, as well as lectures. So right now with COVID, we have had all our lectures at the beginning of the year, and right now we're just really focusing on the placements. So on Mondays and Tuesdays, those are my hospital days. I'm currently doing a placement in general surgery at Queen's Hospital in Romford. And my days really are a mixture of theatre, ward rounds in the mornings, and helping the F1s and F2 doctors with their jobs in the afternoon, or different types of clinics. Wednesday is my teaching day, so Queen's Hospital organized some teaching for us. We call it case-based learning. So we start from a case scenario, a patient coming in, presenting with specific symptoms, specific history. So we think about type of questions that we want to ask them, the examinations that we want to do, as well as the investigations that we would do. And we think of possible differential diagnosis and come up with a management plan as well, which is really helpful. It's very practical. Thursday is my GP day, so I spend the morning in a GP practice in Romford, doing phone consultation, phone and video consultations, as well as some physical ones with patients. And then in the afternoon, again, we have a tutorial with the GP based on case scenarios. And then Friday, again, is my teaching day. So again, Queen's Hospital organizes teaching for us in the morning, and then in the afternoon, we have time for independent studying. And then in my free time, so in between the placements and the teachings, I do work as a student ambassador for the university, as well as for the Center of the Cell at university, which is an educational charity aiming to reach out to students, children, and high school students in the population, trying to get them closer to the STEM subjects, as well as helping those students that are applying to medicine. So just really being a mentor for them. I also volunteer with in the community with local schools for the same reason, really helping students with whatever they need. And finally, the advice that I would give my 16 or 17-year-old self, or to any 16 or 17-year-old, is really to take every opportunity that you can to get experience, to learn more about the career that you're interested in. In medicine, really take every opportunity that you can to do work experience, volunteering, as well as talking to doctors and other healthcare professionals about what the job is really like. There are many pros. It's a very rewarding career, but it's important that you know the downsides as well. And once you're sure that this is really the pathway for you, then go for it. Prepare hard for your interviews, and I'm sure you will do amazing. Thank you for listening.